Hello everyone. I would like to introduce you to our 2020 I Care at Service Award recipients. Thank you to everyone who has worked through the past 15 months of challenging times. Your dedication, perseverance, and commitment to the hospital's I Care at values has not gone unnoticed. Thank you for all that you do each and every day.
Hello Team CGMH. My name is Leslie Paul and I am the Board Chair for the Collingwood General and Marine Hospital. I am very pleased to be here today to recognize and reward this year's Board Award of Excellence recipients. During this past year, each and every one of you have remained strong and committed to CGMH through the COVID-19 pandemic, and your unwavering dedication has not gone unnoticed. That is why this year the Collingwood General and Marine Hospital Board of Trustees recognizes all employees, physicians, and midwives for living our I Care at values. You have contributed to great success across the organization under all of the hospital's key strategic pillars of patient experience, innovation, partnerships, and our people. Everyone has worked so hard to address the ever-changing needs of the COVID-19 pandemic. Your steadfast commitment to innovation saw the team come together to plan, set up, and execute the opening of the alternative health facility. As CGMH is an old building in much need of redevelopment, the team knew early on that an off-site location needed to be investigated. Therefore, during the months of April to June of 2020, CGMH established an alternate health facility, or AHF, at the Collingwood Legion to care for patients in the event of a surge in the volume of patients presenting to the hospital. This was a joint effort between clinical employees, physicians, leadership, facilities, and all the support services that went into creating the location and its continued success. The surge came in early winter and the AHF opened its doors on December 7th. The 18-bed AHF has cared for patients who require an alternative destination of care, patients who no longer require acute care, but may require rehabilitation, long-term care, retirement home, or other post-acute care services. The AHF has provided expanded capacity at the main site during times of surge and allowed the hospital to maintain the additional capacity that was needed for surgeries to continue while they could. Thank you to everyone involved in the establishment and the operations of the AHF and for your commitment to innovation. Your dedication to ensuring patient experience has always remained at the forefront and gave way to new initiatives such as virtual visits that allow patients to stay connected with family members during times of visitor restrictions. Extensive efforts went into the first ever surgical ramp down and ramp back up that the hospital experienced in wave 1 of the pandemic. This was a tremendous amount of teamwork from the physicians, the hospital surgical services, diagnostic imaging, and ambulatory care clinics to make this a success. Once reopened, staff worked diligently to reschedule appointments. It was a massive undertaking both in the hospital and within the surgeons' offices, all with the intent of ensuring our community received access to the care that they had been patiently waiting for and as quickly as possible. Throughout the year, there was continuous collaboration with our Patient, Family, and Caregiver Advisory Council as processes and policies changed and evolved. This team is committed to ensuring the hospital is meeting the best needs of our patients at every step throughout their journey. During this year of COVID-19, the entire hospital team has adapted and pivoted to the ever-changing guidelines and directives, and we are so grateful to everyone for their compliance and patience. CGMH is committed to keeping all those that enter the doors into our hospital safe, as our people are the pillar and the backbone of this organization. Throughout the pandemic, CGMH constantly adapted to the ever-changing requirements and supplies of personal protective equipment, including masks and eye protection, as well as scrubs for employees, physicians, and midwives who required them. Many in the hospital were involved in various committees and working groups that spent a great deal of time reviewing the latest standards and ensuring that the hospital was up to date and our team was well protected. The hospital's flow and space was reviewed with a great deal of work and changes going into directional signage. Rooms were continually assessed for physical distancing regulations. In order to keep our people safe, it was determined that additional cafeteria space was required for team members to unmask and eat safely. Our facilities team did an outstanding job in transforming this space quickly. Our EVS team has upheld the highest levels of cleaning standards, providing an additional layer of protection for all. Additionally, a great deal of enhanced education and simulation training occurred to keep Team CGMH up on the latest standards as team members rehearsed for a variety of potential could-be scenarios. During it all, Team CGMH was kept up to date through a continuous flow of communication in the form of COVID updates, blogs, and videos. Yet it takes many hands to make light work, and the team's success to date has been in part because of the multitude of partnerships the hospital has engaged in. After the COVID assessment tent was set up at the front of the hospital in the early COVID days, the group began to explore different models and methods to determine the safest, most efficient assessment center. 1 month later, it was deemed the best fit for the COVID Assessment Center was a drive-through model that was transitioned to the leadership of the Georgian Bay Family Health Team, physicians, and staff. The assessment center was later relocated to the parking lot of the Legion and now operates double duty as the successful COVID assessment and vaccination center in Collingwood, with the same model operating in Wasaga Beach at the Recplex. The hospital is also part of the South Georgian Bay Ontario Health Team, a collaborative of 11 community organizations that have worked together on various initiatives. The most successful of these projects introduced during COVID is the home monitoring program, where COVID-positive patients can remain at home with their oxygen levels monitored on device purchases by the hospital and supported by virtual nursing visits. This model has now been replicated in several other communities in Ontario. CGMH's collaboration has also extended beyond our community to regional and provincial tables. Regionally, CGMH team members provided representation and input on the setup of the Regional Pandemic Response Unit, a 70-bed facility located at RVH to help care for acutely ill patients that do not have COVID. Representation from CGMH was further provided at the provincial level in relation to surgical ramp down and ramp up, and as part of the GTA incident management team. CGMH accepted patients from RVH at a time when capacity levels were at a crunch and patient load balancing was occurring across the province. To all team members involved in these multiple meetings and initiatives, thank you. And to all team members involved in providing care and assistance to our patients, thank you. Of course, we are continually grateful for the support of our hospital foundation, who in the early days collected community donations of personal protective equipment, managed requests for donations, and supported the purchase of many pieces of new equipment and other initiatives throughout the year. It's truly remarkable to review all that has been accomplished by Team CGMH, and I know the list goes well beyond what was mentioned here today. So I encourage you to keep viewing for a fulsome list of initiatives worked on by Team CGMH over the past year.
Thank you for being inclusive.
Thank you for caring.
Thank you for being accountable.
Thank you for being respectful.
Thank you for your excellence.
Thank you so much for being adaptable.
Thank you for your teamwork.